Hello, my name is Eduardo Huesca. I work for the Occupational Health Clinics for Ontario Workers, or OHCOW. This is a health and safety video developed for Ontario farm workers to share important information and resources on COVID-19. This video is number 1 of 3 and provides an introduction to COVID-19, and we will review the risks for the disease on Ontario farms and COVID-19 safety. We have produced these videos for farm workers working in Ontario, Canada. There are 3 parts to this video, each sharing important information for you to stay safe and healthy during the COVID-19 pandemic. Try to watch all 3 videos, and we share a phone number and email you can use to connect with us if you have any questions or to let us know what additional information you may need. This video was produced by staff from the Occupational Health Clinics for Ontario Workers, or OHCOW. We are a network of 7 occupational health clinics found across the province of Ontario. We focus on supporting Ontario workers stay safe and healthy at work. We work with workers, employers, government, and community service agencies to achieve this goal. Since 2006, we have worked with farm workers arriving to work in Ontario. We travel to many farming regions, so you may have met our staff at one of our mobile health clinics or participated in one of our occupational health and safety workshops on your farm or at a community event or health and information fair. We also distribute occupational health and safety handouts and information to farm workers on how to keep safe and healthy on the farm. We provide employer support to strengthen health and safety programs and work and collaborate with many other agencies and organizations. Before we get started, we wanted to first give recognition and a thank you to you and the other farm workers. We want to start by thanking you for the work you do. We want to ensure you have a safe season and are reunited with family and loved ones in good health. We want to recognize and wish a safe recovery to the farm workers who are currently ill with COVID-19 and thank the healthcare workers who are looking after them. We also give our condolences to the families and loved ones of the farm workers who have passed away from this virus. It is very important we work together to stop future exposure and outbreaks among farm workers. As mentioned, this is the first video of 3. Here you can also see the titles of the other videos. Try to watch them all to get well informed and connected.
My name is Valerie Wolf and I am Eduardo's colleague at OHCOW. What is COVID-19? COVID-19 is a highly contagious infectious disease caused by a type of coronavirus called SARS-CoV-2. In Canada, there are over 114,000 people who have or had the disease, and more than 1/3 of those cases are in Ontario, with more than half in Quebec. Cases, fortunately, in the general population are going down here. However, cases among farm workers are still going up, and that has raised our concerns. Why should you be concerned about COVID-19? 80% of people experience mild flu-like symptoms when they have the disease. However, COVID-19 is much more deadly than the flu. 15 to 20% of people infected need to be hospitalized, and several of those in intensive care. It can cause serious health problems, including severe difficulty breathing, chest pain, loss of speech or movement, and becomes worse with pre-existing conditions like asthma or diabetes, or with increasing age. However, recently, younger adults have also been experiencing severe consequences. Asymptomatic people is something we hear an awful lot about. Some people can test positive for COVID-19, meaning they have the virus but don't experience any symptoms or feel sick. These are referred to as asymptomatic people. Many people may start out as asymptomatic, but a large number go on to develop symptoms. Asymptomatic people can still affect and infect others. It is very important to follow all the COVID-19 safety precautions outlined here and by your employer, regardless if you feel healthy. In this slide, we see how contagious COVID-19 is and how quickly it can spread. If there are no precautions in place, such as physical or social distancing, the number of people infected would be very, very large. And this can be seen here. One person can be responsible for infecting over 400 people in a month. How is the SARS-CoV-2 virus spread? The source of the disease is an infected person, as we can see in this slide. And they cough and sneeze and create droplets of various sizes. And some of those droplets spread through the air and can be inhaled by other people. And some of them fall to surfaces. And then by touching those surfaces, they enter the body if you then put your hand to your mouth or rub your eye or something like that. It is also the case that the virus can spread through fecal matter flushed into the toilet and becoming airborne through that flushing, and then become inhaled or on the surfaces in a bathroom and get transferred to people that way as well. So the most important things to remember are that inhaling droplets and small particles released in the air when an infected person coughs, sneezes, talks, sings, shouts, or breathes is one of the main risk factors. And as well, the smaller particles can hang in the air for hours, so that the risk, particularly the inhalation risk, grows with time and with the level of enclosure of a space. We also need to be concerned about droplets falling to the surface where the virus can remain alive, including floors, counters, and tools for several hours or even days, especially on plastic. And this is a particularly concern with respect to touching those surfaces and then touching your eyes, nose, or mouth, which is really important to avoid doing where possible. Surfaces and air in the washrooms can also be contaminated because the virus can be found in and around toilets as a result of the feces, as we mentioned earlier. So we need to pay particular attention to those environments. Let's just review what the signs and symptoms of COVID-19 look like. Unfortunately, COVID-19 symptoms are similar to other illnesses, including heat stress, a cold, or flu, and so can be confused with those other more common diseases. More commonly reported symptoms in adults include fever or chills, a dry cough, tiredness or weakness, a new loss of taste or smell, aches and pains, sore throat, GI symptoms like diarrhea, abdominal pain, and vomiting, headache, conjunctivitis, which is otherwise known as pink eye, and as mentioned previously, serious symptoms like difficulty breathing, shortness of breath, chest pain or pressure, and loss of speech or movement. There have already been more than 1,000 temporary agricultural workers who have been diagnosed with COVID-19 in Ontario in at least 15 outbreaks, and 3 workers have sadly died, including Bonifacio Eugenio Romero, whose photo we include here, who was the first to pass away in early June. The main areas affected are Windsor, Chatham, Kent, St. Thomas, Haldimand, Norfolk, and Niagara. Individual workers have also tested positive, but at the same time, on lots of farms with strong safety practices, no workers have developed COVID-19, which tells us that prevention is possible. Migrant farm workers have greater risk of exposure to SARS-CoV-2 for a variety of reasons. Some of the reasons are that equipment places workers close to each other when they're working in fields or in other places. Example, when planting. And also tasks can place workers together. That's another example, like packing fruit or vegetables. Workers often share tools, and also they work far away from running water. So soap and water is difficult for hygiene. They live in shared housing, which can be cramped in the sleeping quarters, in the washroom, and in the kitchen. They often move around through group transportation, like little buses or vans and cars, which is an enclosed environment. They also need to visit town and encounter people there, and also interact in other environments to get supplies and services. And they mix with many people on the farm and off the farm, which elevates the risk. Migrant farm workers also have a greater risk of infection with COVID-19 because the disease is spread from person to person or person to environment to person. So the more that people are together in enclosed areas, the higher the risk. Plus, the illness is often hidden because it can be so very mild or still developing, and people are asymptomatic. Workers have now been prioritized for testing, but there's still some uncertainty about that and some delay in getting the results back. So we're not aware of who is infected and who isn't. And it is also true that workers may not report mild cases because they fear or of uncertainty about the loss of wages or the potential for reprisal or even being sent home. And some bosses may not take mild symptom reports seriously either, since it looks so much like a cold or allergies.
So we know you have arrived to many new safety policies and procedures on your farm and workplace, as well as in your housing. This has included, for example, 2-week quarantine periods when a worker first arrives, as well as safety practices such as those that focus on physically distancing from others, an importance on personal hygiene precautions like coughing and sneezing safely and washing your hands, as well as cleaning and disinfecting routines of tools, machinery, and other objects and surfaces found in your workplace and in housing. Your employer should provide you with COVID-19 safety information and an orientation to the safety practices on your farm as well as in housing, as well as provide you training on personal protective equipment use. If you do not understand something, make sure to ask questions and share any concerns you may have, as it is very important you understand, follow, and contribute to safety practices, especially during this pandemic. We want to review key safety messages for COVID-19 safety to make sure you know how to keep yourself and those around you safe. First, if at any point you feel any symptoms of illness, it is very important you report this to your supervisor or employer right away, or to a healthcare clinic. We are going to review how to do this in our next video. It is very important to report right away, and while you wait for further direction, stay away from other people, so in the case that you are sick with COVID-19, you do not pass this on to others. Talk to your coworkers about the importance of having them report if they have any symptoms as well. As we will review, if you do become sick, there are supports to help you recover, and financial supports if you are sick and not working as well. Let's review key COVID-19 safety practices that both control the spread of the virus and help protect from it. First, it is very important to physically distance, to keep a distance of 2 meters from others as much as possible, to reduce the chance of spreading the virus among people. It is very important to wash your hands frequently with soap and water for at least 20 seconds. This will kill the virus that could be on your hands and therefore help avoid its spread. You can also use an alcohol-based hand sanitizer of at least 60% alcohol. Avoid touching your eyes, nose, or mouth, as your hands could be contaminated with the virus, and your eyes, nose, and mouth are key entryways the virus can enter your body. Again, wash or disinfect your hands frequently. If you need to cough or sneeze, do so into your elbow or into a tissue, not into your hands. Do not reuse tissues and throw them out immediately, and wash your hands. If you notice you are sneezing or coughing frequently, report these symptoms. Connected to physically distancing, avoid close contact with others, such as shaking hands to greet. So ensuring you follow these COVID-19 safety practices all the time is important. And in addition, there are more safety practices to follow in the context of when you are working on the farm or workplace, as well as when you are in shared housing. Recognizing that both work and housing bring people into common areas and spaces, so safety is very important. At the workplace and in housing, safety measures focused on controlling the spread of the virus and protecting against it should prioritize starting with the most effective measures. In terms of COVID-19, this includes first trying to control the potential source of the virus to eliminate the risk for others. For COVID-19 at the workplace or housing, this includes limiting the number of workers in a space, having workers spaced out and physically distanced. This is done so that individuals are far enough away from each other so that if someone had the virus, it would not spread between people. From there, if workers are required to share space and be closer to one another, then safety measures should be put in place, like putting up barriers or ventilating the air, to try to eliminate the chances of the virus traveling from one person to another when people are closer in distance to each other. Wearing surgical or cloth masks are less effective than barriers and ventilation, but are also meant to help reduce the chances of droplets from one person that may have the virus traveling into the air or onto surfaces, increasing the chances of infection for others. So again, these measures are meant to try to reduce the travel of the virus. The last level of protection includes measures that focus on protecting the individual from the virus at the point where the virus may be present close to them. This includes having people wear personal protective equipment, such as respirators or face shields or gloves. As we will discuss further, surgical masks or cloth masks do not significantly protect the user from breathing in the virus, but again are meant to prevent the travel of the virus into the air or onto surfaces. The main message here is that at your workplace and farm housing, COVID-19 safety and protective measures should prioritize those that are the best and most effective. As we mentioned, it is very important to physically distance to keep a distance of 2 meters from each other as much as possible. This will reduce the chance of spreading the virus among people. If you encounter a work activity or a situation in your bunkhouse that does not seem to allow you to physically distance from coworkers, stop and bring this up to your supervisor or employer to address your safety concern. If physically distancing is not possible, other levels of safety measures should be considered and applied. Physically distancing should be maintained as much as possible during transportation, both in terms of transport to different work locations, as well as any transport off the farm into towns or public spaces. During transportation, you should wear a face mask to reduce the transfer of your droplets, and you should make sure to follow safety practices such as not touching your eyes, nose, or mouth, avoiding high-touch surfaces, and washing or disinfecting your hands frequently. Ventilate spaces, rooms, and closed areas so that fresh air enters. You do not want the accumulation of exhaled air in these spaces. In the case of an infection, the virus may be present in the exhaled air of a sick person. Keep windows and doors open as much as possible. If possible, use your own tools assigned to each person or the same few people. This way, many people are not touching the same tools, risking the transfer of the virus through hands and tools. Regardless, disinfect tools before and after use to get rid of the virus if it was on the tools. Make sure to disinfect frequently touched equipment, like steering wheels of vehicles or handles of mowers or trolleys. This way, again, you can get rid of the virus if it was present on these surfaces. Employers should provide cleaning and disinfecting solutions and materials. Make sure to disinfect and clean any work and housing surfaces that people touch or that may have come in contact with any droplets from people. Your workplace should put in practice a regular cleaning schedule. The same idea here. Make sure to disinfect frequently touched items such as doorknobs, light switches, and other objects and surfaces in the workplace and in housing that many people could be touching. Your employer may recommend or ask you to wear gloves at work. This will reduce the risk of having your hands come in contact with surfaces that could be contaminated with the virus. However, even with gloves, avoid touching your face, eyes, nose, or mouth. We will talk more about safe glove use in the following section. Make sure you wash your clothes frequently to reduce the chances of the virus staying on clothing and spreading. Also wash and disinfect your shoes or work boots regularly. If possible, consider leaving your work shoes outside and not wearing them inside your house to avoid the risk of bringing the virus from high foot traffic floors at work to your housing spaces. Make sure to clean and disinfect laundry machines, especially on the surfaces that people touch. In general, safety measures that should be taken to reduce the risk of virus transmission at work and in housing include organizing fewer workers in a space to allow for physical distancing, staggering work locations, breaks, and meal times as to also allow for space and distancing. Consider keeping work teams small and having these teams live, work, and eat together, avoiding contact with other workers as much as possible. Organizing as much time outside as possible in open air or in large spaces. In indoor spaces that are shared, increase ventilation to bring in fresh air or add air cleaning. In situations where workers are working close to each other, put up physical barriers to stop the possible travel of the virus. Review what personal protective equipment is needed and provide training to its use and disposal. Discussion on safety concerns and ideas should be promoted and supported at the workplace and include workers, supervisors, and employers. By now, most of us have used or worn different kinds of safety equipment during this pandemic, including masks and possibly gloves. This equipment is referred to as personal protective equipment, or PPE. At different workplaces, different types of PPE may be needed and used. However, as mentioned, PPE is used when other, more effective safety measures are not possible. For example, keeping a distance from others provides a high level of protection from this virus. However, PPE is worn when you are coming closer with others. There are a few things to consider with PPE. First, it is important to know what the PPE is for and how it protects you to make sure you use it correctly and to make sure you follow safety measures to keep yourself safe even when wearing PPE. For example, cloth or surgical masks, like the ones most of us are wearing, are different than a respirator used by medical staff who are working directly with those infected by the virus. Respirators provide a much higher level of protection and protect from smaller particles and airborne contaminants, so they can protect medical staff from breathing in the virus that can be traveling in the air from their sick patients. A face mask, like the ones most of us use, provide barrier protection against large particle droplets and do not significantly protect us from small particles in the air or from breathing in the virus. So we still need to be careful when sharing space and air with others, especially when in small indoor spaces. These face masks, again, are more meant to help the person wearing the mask keep their droplets to themselves and not have their droplets travel into the air or onto surfaces or objects, putting others at risk. Again, the idea is that if we all wear face masks in public or when we are close to others, we can reduce the travel of droplets that may have the virus so we can help limit the virus's spread. In addition, knowing how to keep safe when wearing PPE is important. For example, once you put on a face mask, it is important not to touch it with your hands, as your hands could be contaminated, and you can risk transferring the virus onto the part of the mask that is against your nose and mouth. You will be asked to wear PPE, like masks, in locations where workers are sharing space, for example in transportation or vehicles traveling to different work locations, as well as during transportation off-farm or into towns, including if you enter grocery stores, banks, or other similar public spaces. As we have mentioned, you may be asked to wear gloves at work to protect your hands from coming into contact with the virus through touching surfaces or objects like tools or equipment. However, gloves can spread the virus if you touch your face with gloves you have used, as gloves you are wearing could have gotten contaminated by you touching surfaces or objects. You can also spread the virus if your gloves are contaminated and you start touching different surfaces or objects as well. Even when you are wearing gloves, do not touch your face and continue to disinfect objects and surfaces you and others are touching. It is also important to know how to safely put on, take off, and dispose of PPE, like gloves or masks, which we will review in the next section. For example, always wash your hands before and after you use gloves and masks. Talk to your coworkers and boss if you think you need PPE like gloves and masks. Employers have the responsibility to supply PPE when it's needed. Let's review the safe way to use face masks. Wash your hands with soap and water for 20 to 30 seconds, or use hand sanitizer that contains alcohol before touching the mask. Check the mask to make sure it is not damaged. Make sure you put on the mask on the right side, usually the brighter color side facing out. Locate the metal part of the mask and place it on your nose and press so that it takes the shape of the bridge of your nose. Put on the mask by holding the loops or straps. Put them around your ears or tie them. Make sure you cover your mouth and nose completely so that you don't leave space. Press the metal strip back onto the bridge of your nose if the mask has the strip. When you use the mask, try not to touch it or touch your face since your hands may be contaminated. If you need to adjust the mask, use the elastics or ties to move it up or pull it down. Before moving the mask, wash or disinfect your hands. Remove the mask from the ties or bands. Do not touch the part that touched your face. Throw away the mask immediately if it is a single-use mask, or wash it if it is a reusable mask. You should wash reusable masks after each use. Always wash your hands before and after wearing a mask. As mentioned, gloves protect the hands of the person wearing them, but it is important you use gloves safely. When using gloves, grab a fresh pair. Do not go to the washroom or eat with gloves on that you have been wearing. You should take gloves off and wash your hands thoroughly before these activities, and then put on a fresh pair of gloves after. If not, wash your hands with gloves on. Always wash your hands before and after wearing gloves. Let's review how to safely remove gloves. When removing gloves, try not to touch the outer part of the glove that has come in contact with surfaces or objects. A recommended way is to first pinch and hold the outside of the glove near your wrist area. Pull the glove downward away from your wrist, turning the glove inside out. Pull the glove away until it's removed from the hand and hold the inside out glove in the other hand that still has a glove on. Then with your free hand, slide your fingers down the inside of the wrist of the hand that still has a glove on. Try not to touch the outer surface of the glove. Pull downward away from the wrist, turning the glove inside out. Continue pulling until the glove turns over and with the other glove inside of it, and you are left with a bundle of the used gloves. Throw away the bundle into the adequate garbage and wash your hands immediately. If while taking off your gloves you touch the outside part of the glove, that is okay, but then be very careful not to touch your face or objects or surfaces and wash your hands immediately. Public health units have provided farmers with safety guidelines for worker housing. Your employer should follow the guidelines and give you safety information and instructions as well. We do not want to confuse any information that the health units or your employer have given you. However, we want to draw your attention to some important health and safety considerations. During this pandemic, washrooms are a space we have to pay particular attention to in terms of health and safety, especially when we are sharing a washroom with others. The risk for transmission of this virus in washrooms is based on the fact that washrooms have a lot of high-touch surfaces. Washrooms are also a space where we may spread a lot of our droplets onto surfaces and objects. For example, if a person spits or blows their nose. In washrooms, we may also run the risk of coming in contact with a person's fecal matter that can carry the virus if the person is sick. Some important safety practices, particularly when you are sharing a washroom, include cleaning surfaces and objects regularly, many times a day, or even after each use if you want to be extra careful. Try to avoid touching the toilet with your hand, and if you do so, wash your hands right away. Wash the toilet regularly, but be careful when doing so. Make sure not to touch your face and wash your hands. When cleaning the toilet, try to keep at a distance as much as possible. For example, spray the toilet with a disinfectant spray at a distance before getting closer. Open windows and ventilate the washroom before cleaning it. Wash your hands before and after washroom use. Keep the number of people sharing the washroom as low as possible and keep sharing among the same small group of people. Try to wait 15 minutes between users of the washroom and ventilate the washroom between uses as well. Store your belongings in a safe place outside of the washroom to reduce the chances that they can become contaminated. Do not share washroom objects, such as towels, and wash them regularly. Carefully dispose of washroom garbages like tissues frequently, and wash your hands right away. Talk to your coworkers who you are sharing a washroom with about safety ideas and concerns to make sure you are on the same page. Share concerns or safety ideas with your supervisor and employer as well. Sharing a kitchen can also create risk for the transmission of this virus, as there are a lot of frequently touched objects and surfaces in the kitchen. If you're sharing a kitchen, clean surfaces, dishes, cutlery, pans, and other objects immediately after using them. Also clean objects like doorknobs, handles of fridges or other appliances, the tap, light switches, and anywhere else that people touch. The idea is to reduce the transmission of your droplets onto these objects or surfaces, or disinfecting them right away if droplets are transmitted. Although usually it is a good idea, during this pandemic, avoid sharing things including food like salt, pepper, sauces, coffee, tea, milk. By sharing, various people may be touching these objects and food and therefore risk transmission of the virus. You should take out the garbage so it is not left in the kitchen for long. Wash your hands after taking out the garbage. Organize the kitchen to have as much space between people as possible, and schedule cooking times so that there's only a few people in the kitchen at the same time. When the weather allows, prepare, cook, barbecue, and eat outside in the open air. Again, outside and being in open air reduces the chance of transmission if someone was sick and their small droplets were circulating in the air around them. If it is not possible to be outside, ventilate the kitchen as much as possible. Open windows and doors. Talk about kitchen safety concerns and ideas with coworkers you are sharing a kitchen with, as well as with your supervisor and employer. It is important to also recognize the risk for the transmission of this virus in shared bedrooms. The risk here is sharing space with someone in close quarters for a long duration of time, including the hours of sleep overnight. If you are sharing a bedroom, set up beds at a distance greater than 2 meters apart. There is a risk of using both levels of bunk beds, as the exhaled air of the person on the bottom bunk can travel up to the person on the top bunk, so it is better to just use bottom bunks, and again, keep beds far from each other. Store your belongings in a safe place away from others to reduce chances of contamination and to allow for safe movement within the space and avoid chances of tripping. Ventilate the room, open doors and windows. Fans can help, but be careful of the direction fans are blowing. The idea is to let fresh air in and blow exhaled air out. You do not want to blow the exhaled air of someone in the direction of another person. Handle used clothes and bed sheets carefully. Try not to shake them out inside. Wash them frequently with warm or hot water. Consider not wearing your work shoes indoors to avoid the chances of bringing in anything from busy work floors into your housing. Talk about any bedroom safety ideas or concerns with coworkers you are sharing space with, as well as with your supervisor or employer. Leisure and non-work time is important for your physical and mental well-being. You may be traveling off of the farm to retrieve essential goods, like doing your groceries or banking, or for leisure time, like going for a walk or socializing. All of this is very important. However, just make sure to follow COVID-19 safety precautions during non-work time and during travel off-farm. Concern around off-farm travel is about the risk of coming in contact with the droplets of someone in town who may be sick with the virus, and then traveling back and bringing the virus to the farm. That is why it's important to follow precautions like physically distancing, being careful with touching surfaces others could have touched, avoiding touching your eyes, nose, or mouth, and washing or disinfecting your hands frequently during travel, leisure, and socializing time off of the farm. Depending how this pandemic continues, public health officials are able to tell people to stay away from certain public spaces based on decisions around public safety and stopping virus spread. In such a case, travel into public spaces could be affected. However, currently, everyone, including farm workers, can travel into town and into public spaces. Again, just practice your safety measures to keep yourself and others safe. Discuss any concerns around leisure time or off-farm travel with your supervisor and employer. The government ministry that is connected to the issue of health and safety at work is the Ontario Ministry of Labour, Training and Skills Development, or the MLTSD. This ministry is responsible for the prevention of occupational injury and illness at Ontario workplaces. It sets, communicates, and enforces occupational health and safety requirements under the Ontario Occupational Health and Safety Act, or the OHSA, which we will talk more about in our third video. The MLTSD inspects workplaces for health and safety issues, including farms, and investigates complaints it receives. It also investigates work refusals and critical injuries or illnesses and ensures regulations are followed. As we will review more in our following videos, under the Occupational Health and Safety Act, your supervisor and employer have the responsibility to address health and safety concerns on your farm and work with workers to do so. So report your concerns to them. However, if your health and safety concerns are not addressed at your workplace, you can contact the MLTSD for support and guidance. The MLTSD responds and provides support regardless of your immigration status, and it does not report or enforce immigration regulation. Again, your supervisor or employer should resolve any occupational health and safety concern you may have. You can also discuss any concerns with your worker health and safety representative or joint committee member, if there is one at your workplace. We will be speaking more about these reps and committees in our third video. If your concerns are not addressed at your workplace, the Ministry of Labour, Training and Skills Development is here to help. You can call the ministry's Occupational Health and Safety Contact Center. You do not have to give your name when calling, and you can ask for more information about this process. Call anytime to report critical injuries, fatalities, or work refusals. Call between 8:30 a.m. and 5 p.m. Monday to Friday for general inquiries. The toll-free number is 1-877-202-0008. Press 1 to report an accident or work refusal. Press 2 to report a complaint, including COVID-19 concerns, or press 3 if you have questions. Once you have reached a telephone agent, you can also ask for services in other languages. You can also email questions to webohs@ontario.ca. Responses to emails will be provided within 5 business days. In an emergency, always call 911. In Ontario, under the Occupational Health and Safety Act, all workers are protected against facing reprisals. A reprisal is when a worker is unfairly punished or fired for reasons that go against their rights. So, if a worker is engaging with health and safety, raising health and safety concerns, or reporting a hazard or acting in accordance to their health and safety rights, an employer or supervisor cannot dismiss or threaten to dismiss a worker. They cannot discipline or suspend a worker or threaten to do so. They cannot impose or threaten to impose any penalty upon a worker, and they should not intimidate or coerce a worker. If a worker feels like they are facing reprisal, they should contact the Ministry of Labour, Training and Skills Development's contact center. Again, the number is 1-877-202-0008. That concludes this video. If you have any questions about this video or if there's additional information you need, call or leave a message at our OHCOW number at 289-684-2821 or email us at mfw@ohcow.on.ca. Thank you, keep safe, and watch our next video.